ATTACH is a national association focused on developmental trauma attachment disorders in children. The group is holding an international conference in Scottsdale this weekend and here to talk about how best to approach issues of early abuse and neglect and the impact of childhood traumatic attachment. We welcome Mary McGowan, Executive Director of ATTACH, and the association's board president, Thomas Ahern. Good to have you both here. Thanks for joining us.
Happy to be here.
Give me a better definition. What is ATTACH?
Well, ATTACH, what we do is we train the front line, if you will. So children that have had early abuse and neglect, sometimes it's through divorce, military deployment, but a lot of times when you look at opioids and other factors that have parents from the beginning of life unable to care for or react to the needs of an infant, it all starts there and changes the course of their life. And so what ATTACH does is we create trainings through understanding of research that has been done over the past 20 years, and we move towards giving the tools, understanding, and education to anyone working with children and youth.
The definition of developmental trauma and attachment disorders, has that definition changed over time?
Yeah, I think it has. And, actually we've been involved with a real movement to try to get what we call developmental trauma disorder recognized by the medical establishment and included in what's called the DSM, the Diagnostic and Statistical Manual of Mental Disorders, so that these kids can get the right treatment at the right time and for the right reasons. It's been a little bit of trouble to get that recognized by the establishment, but we think we've got all of our research in line, and we're really looking forward to the next installment of that. Some
of the treatment that would be involved in whether it's opioid abuse, whether it's someone who's a parent might be involved in a victim of a crime, whether it's a border situation where a family is broken up down there. What kind of treatment is it? Does it depend on the individual, or is there an overarching emphasis?
I think there's an overarching emphasis here. What we've learned over time is that the brain structure actually changes. And so for children that have been around trauma, they have fear, they stay in the caveman brain, as we call it, or the lower brain, and they're unable to access what we call the cortical region of the brain.
What's the caveman brain?
The caveman brain is the original brain with fight, flight, or freeze. So when you picture, you either run, you shut down, or you fight back when you are afraid.
My goodness.
Yes.
And you see that in kids how young?
As early as early elementary school ages, even in still infancy. It's they get dysregulated emotionally, and this is the stuff, this disruption in the caregiver relationship that sets kids up between the 0 and the age 7, if you will, for later relational problems. And most of the symptoms and the diagnoses and the stuff that we're trying to address, from opiate addictions to suicide, depression, anxiety, all of this can be essentially traced all the way back to something that happened in that caregiver relationship or disruption in that caregiver relationship between those ages.
Are these things that an adult doesn't even realize, wouldn't even remember the problem from 0 to 7?
We call that implicit or pre-verbal memory. And so our body holds every memory that exists. So when before you can speak pre-verbal, you have an ability, your body fires neurons, and it actually changes the course of how your brain works. And so children may react to a smell, a sound, a voice tone, and panic, and no one knows why, but something in their body was triggered, and they actually go back to that moment.
Wow, that is, how do you, if you're not even aware of what happened when you were young, and yet you got some problems going on here, how do you know? How do you get back to that? How do you investigate that?
Well, I think it's by establishing relationship. I mean, the real thing that helps to heal is really experience in relationship. But that means having the ability to go and maybe enter into some therapy or to develop some trusting relationships. And what's really great about the state of Arizona is that the governor and his wife have really been pushing hard to create a trauma-informed state, whether it be at the municipalities or judiciary or police, schools, et cetera. That's really going on, and that's why we're going to recognize Mrs. Ducey at the conference this year.
Right.
And did I read that 40% of adults have less, and children have less than secure, 40%?
40%, and that's the general public. And then when we look at foster care and the adoption system, we're at 95 to 100%.
I was going to say, how can you avoid it with foster care?
You can't. You leave a home no matter what the circumstances and come in with strangers who you don't know, you're not familiar with anything that's happening around you. It's unnerving, and children don't adjust to those kind of things. They need to be with their primary caregivers if possible. And when they're with foster parents, we need to train them and get them the knowledge and education so that they're in a position where they know how to respond, because it's very different than traditional parenting.
Is there a way for someone who experienced this as a very young person? Maybe they're now a teenager, maybe they're a young adult, maybe they're middle-aged, maybe they're a senior. Are there different levels of figuring this out and trying to move forward?
Yeah, I think there's lots of resources. There are a lot of people out there that are willing to help. One of the first things, perhaps maybe someone can do some reading about it. Someone can watch some YouTube videos, Instagram. There's lots of organizations out there dedicated to trying to help create awareness, some compassion, some empathy, and some understanding as the lifelong impact of this stuff.
Well, let's say someone is aware. They find out, okay, I understand that maybe I was in foster care, maybe there was something else going on.
Yeah.
What's next? How do you deal with it?
Yeah, I think it's a point of just reaching out and asking for help.
When you ask for that help, do you talk it through? Do you live it through? What do you do?
Yeah.
Well, it's a series of things, and that's generally when we hear from people from all over the world. They'll call us and say, I never knew this, but I think my child has some kind of early trauma or attachment issue. What do I do? So we hook them up. If it's a parent, we hook them up to parent support with our parent advocates. We get them involved in training and understanding so that they can understand what is going on, why children do what they do. They're not intentionally being bad. They are in this survival mode of trying to protect themselves from feeling rejected. And so we start there and we build over time with education, awareness, and then different approaches.
Right, I would imagine that has to be different.
Absolutely.
It can't be a one-size-fits-all thing.
Yeah, I think the part that's critical is that, lots of people say get therapy. But what we've learned over the years is that there's a specific type of therapy that really is important. And that has to happen, again, as I mentioned, in relationship and experience, because experience gets beyond the frontal cortex that covers up that part of the brain that's been, impacted. And that's really where the real developing new neural pathways in the brain, that's where the change begins to take place.
And this conference intended for professionals, parents?
Yeah, so our conference is it's October 3rd through the 5th in Scottsdale, Arizona. It is for everyone. We pride ourselves in our tracks. We have tracks for parents and clinicians, therapists, teachers, occupational therapists, child welfare. We kind of have workshops and trainings for everyone. It's a vital and important time for people to come out. And if you just go to attach.org, you can find all the information.
All right, attach.org. Mary McGowan of Attach and Thomas Ahern of Attach. Good to have you both here. Thank you so much for joining us.
Thank
we
you.
appreciate it.